Welcome back to 3 Minute Physio. Today, we're diving into the bones of the hip. First off, let's understand what a hip is and how we as physiotherapists will encounter it. Whether we see it through x-rays, MRIs, or in-person assessments, the hip plays a crucial role in movement and function. Now let's break down the anatomy. The hip is comprised of 3 main bones: the femur, acetabulum, and the pelvis. The pelvis is then further broken down into the ilium, ischium, and pubis. The hip is classified as a synovial ball and socket joint, and it allows for a wide range of motion, essential for daily activities. Understanding bony landmarks is key for clinical practice. We focus on the greater trochanter, lesser trochanter, head of femur, and the neck of femur. And then for the pelvic girdle, there are several more to consider, such as the anterior superior iliac spine, which can be shortened to the ASIS. Then you have the posterior superior iliac spine, or PSIS. This is commonly referred to as the small of the back. Then you have the anterior inferior iliac spine, which is the AIIS. And then the iliac crest, which is this top ridge just here. Finally, the last important landmark to note is the ischial tuberosity, which is deep within the glute muscles. It's quite rare that you will have to palpate this one as a clinician due to the sensitivity of the area. Similarly, you also have the pubic symphysis, which is hard to justify palpating unless you really have a good reason to. These landmarks help to guide our assessments and interventions. Now let's visualize the functions of the hip. So the key movements are flexion, extension, abduction, adduction, and rotation, both laterally and medially. Moving on to common hip pathologies, we encounter conditions like osteoarthritis, which is a typical age-related change, osteoporosis or osteopenia, which is reduced bone density, and this can lead to an increased risk of fractures through trauma. And finally, impingement, which can be divided into cam and pincer deformities. A pincer deformity is when there is extra growth on the edge of the socket joint or the acetabulum that can sometimes cause pain and stiffness. Whereas a cam deformity is a type of impingement in which the femoral head extends further down than normal, again sometimes causing pain and stiffness, but not always. As always, it is essential to be vigilant for red flags. For the bones of the hip, these include signs of cancer, recent falls or trauma, indications of infection, rheumatological symptoms, or avascular necrosis. And that's it for today. I hope you enjoyed this insightful journey into the world of the hip. Don't forget to like, share, and subscribe for more valuable content. Until next time.